stock still trading higher here as the NASDAQ is up by about 1.1% after today's stronger than expected jobs report for the month of June. But investors are also grappling with worrying rises in case counts here on the coronavirus front. In the U.S., we just reported roughly 50,000 cases here yesterday. That was good enough for the fifth single-day case record in the last 8 days. And importantly, Florida is also showing more worrying signs there as cases rose up more than 10,000 on Thursday, its biggest daily increase since the pandemic started here. And for more on all of those concerns right now, I want to dig into it with Dr. Uché Blackstock. She's Advancing Health Equity CEO and Yahoo News, a medical contributor as well. And Yahoo Finance's Anjali Kamlani joins us again as well. And Dr. Blackstock, I mean, when we look at this is something that a lot of people feared, because right now you've got the trend line basically completely reversing from what we had been working so hard and everybody had been staying at home, social distancing. How worrisome is it after all those efforts to see this going in the wrong direction?
Okay, so this is incredibly worrisome. And you're talking to someone who I was treating patients on the front lines here in New York City in March and April. And, what we're seeing are even higher numbers, in Florida and California and Arizona. And so I think what's going to happen is that the leaders of these states are going to have to make some really, really tough decisions. I know some have even closed down indoor dining, but I think we're going to have to go a little bit harder than that. And we may have to go in reverse back to shutting down. The problem was that, there were cases were on the rise as reopening was happening. And so this was the inevitable outcome of that.
Dr. Blackstock, Anjali, good to see you again. When you're talking about what's going on in all these other states, a lot of different factors are affecting them as well. What you saw was the start of the epidemic, and the shortages of supplies was a key problem. But I feel like that's not as much the case down in the South, or is it? And what have been sort of the differences you've seen?
Well, I think there are some similarities and differences. I think that I would have expected some states, like Florida, Arizona, Texas, to have put in place stronger infrastructures around testing and contact tracing. I mean, there are people who are saying in Arizona, they're saying they can't get tested. The lines are too long. That shouldn't have been the case. Those states should have learned from New York's experience. I think also another concern, especially in the South, is, they really have a very poor public health infrastructure. And then also out in the West, there's a high rate of uninsurance. And so my concern is that the virus is really going to hit these states a lot harder than it hit New York for those reasons.
Yeah, and Doctor, when we talk about these states, we open with Florida just because the numbers there are really quickly rising there. But you can even point to California as you talk about moving in the wrong direction. That's another one where we're seeing the governor there close down bars in 19 counties ahead of 4th of July weekend because of their case count. But when we talk about how New York is planning on, we got the update that Mayor Bill de Blasio wants to open schools up in September. And yet it also wants to ban travelers coming in. It just seems like this is a rolling problem that we're going to see probably still be around in September. So what do you think of the idea that we're already assuming schools will be back in September, and what could happen to other states?
Right. Yeah. So definitely this is going to be a rolling problem. I think, there's some few things that we know. Indoor dining, bars, clubs, are a bad idea. We know the virus acts very, very poorly indoors, and we have a high rate of transmission. Schools, on the other hand, are actually quite different because we have a lot of great evidence that kids really don't carry a lot of the virus and they don't pass it on to each other or adults. And so I think we're going to have to see some really creative, innovative ways of getting kids back to school. But in the long run, yes, it's going to be a lot about these little fires that we're going to have to put out. It may not be a full shutdown, but partial shutdowns may have to be put in place.
Dr. Blackstock, one more thing really quickly on the contact tracing. Like you said, all these other states could have gotten ahead on that. But it seems like right now it just seems like we don't have any contact tracing going on. Should we just abandon that at this point, that idea?
No, it's never too late. So there are these basic public health preventive measures like testing, like contact tracing, like physical distance that we know it works really well, or universal masking. And so we really have to still fight, despite these really high numbers, to get these infrastructures in place to make sure that we're testing, tracing, and isolating people in order to prevent the spread of the virus.
Hey investors, Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.